said, my name's Lawrence Gobetz. I'm a reproductive medicine specialist, and I've been working in the field of reproductive medicines since 1989. Because it's a women's forum and a women's issue, I'm going to look at what is really happening out there and why. Why are we seeing ultimately more patients with infertility? And that's why. Family is very low down on the pole, and career is obviously more important. So women today will go to university, they'll establish themselves in their career, they will then settle down, they'll want to have a bank account, they'll want to put some money in the bank, and then eventually they'll find Mr. Right. And Mr. Right today is tested for 5 years. We call these starter marriages today. And if it doesn't work, it's like a computer out, and we bring the new one in, you know. And then by the time these young women are ready to go out and have babies, they've missed the boat.
A woman's fertility level changes over time, and most people underestimate when it starts to rapidly decline. Whether you're currently trying for a family or planning to start one in the future, it's important to know the facts about female fertility. Did you know that when trying to fall pregnant, a 30-year-old woman has about a 20% chance of conceiving each month? This can be complicated by possible health issues, such as endometriosis, polycystic ovary syndrome, fibroids, and chlamydia. Then there are lifestyle factors that can reduce fertility. Smoking, excessive alcohol, and obesity can all reduce your ability to conceive and increase the risk of complications. But the biggest factor influencing your fertility is age. Women are born with every egg they'll ever have. Your eggs age as you do, and over time, they decrease in both quantity and quality. Once you turn 36, your chance of conceiving naturally is about half what it was when you were 20. By the time you're 41, your chance of conceiving naturally each month is just 4%. Your age not only increases the length of time it will take you to fall pregnant, but once you're there, you'll have an increased risk of miscarriage and birth defects. You're also more likely to experience complications during pregnancy and at childbirth. But women have a lot to balance nowadays: choice, circumstances, options, and it's not all bad news. Even though female fertility decreases rapidly after the age of 36, that hasn't stopped Australian women of all ages from achieving their dream of motherhood. Over the past 20 years, the average age of women giving birth in Australia has increased by 7.5% to 30 years of age. And in the last 10 years, the proportion of women giving birth aged over 35 has increased from 18 to 23%. In fact, 4% of women giving birth are now aged 40 plus. For many fertility issues, including age-related issues, assisted reproductive technology, like IVF, can help. 1 in 25 births in Australia are now the result of IVF. The average age of a woman giving birth who had undergone IVF is 34, 4 years older than the average age of women who had unassisted pregnancies. With medical technologies becoming more advanced, there are options for many women who are affected by fertility issues. But it can be a longer and harder road. When it comes to choosing to start your family, you'll have plenty of factors to consider. Make sure that your fertility is one of them. Know the facts about your fertility.
This is how we all feel every day. And sometimes even on weekends, because work doesn't stop, because it's now a weekend. And life and time just passes us by, and one then sort of says, well, you know, I should just be falling pregnant. And so, just this cartoon, with the benefit of hindsight, we feel it was around about here that things started to go haywire. And when was that? That was in the early 90s. Things changed. My mother, by 21, had 3 kids at home. And if you go back to the 50s and early 60s, that was appropriate. And if we look at the potential of women, you reach your peak somewhere between 16 and 24 years old as far as your egg function and quality goes. This is not a South African problem. This is not an African problem. This is a global problem.
Thanks.
So the donors are very highly selected. If we get 100 bites on the end of the hook, we may only be able to accept 5. So they are screened out at a sexually transmitted disease level. They are screened out for a lot of the other genetic things like diabetes and high blood pressure, etc. They have a full family history. So you as a recipient will know whether the donor was adopted or not, because if she's adopted, she can't give you that family history. So you've got a full profile. And the serious diseases that we worry about, we exclude. We know their blood groups. You are allowed to see pictures of the donor up until age 10. So you could match a picture of yourself at 10 with the donor, and it often works very, very well. So you will be able to, as a recipient, see the whole profile of the couple, including what her grandfather died from and what her father died from, etc. Plus, yes, we are very protective at that level. And if we are doing HIV screening and reusing the donor, we make sure that 3 months prior to taking the eggs out, that they remain negative for HIV, hepatitis B, hepatitis C, chlamydia. So we're constantly on top of that. Firstly, the reason for not menstruating is dependent on the age of the female. You know, she's 50, it's quite normal for her not to menstruate. But if the woman is a young woman, the reason for her invariably not ovulating is probably either what we call polycystic ovaries, which should not be drilled, or she's just not ovulating, okay? Now, despite that, so if you're on the pill, or if you're pregnant, so for the pill, every month you're still losing those eggs, but no eggs are running to dominance, so you will not fall pregnant. Once you're pregnant for those 9 months, again, you still are losing those eggs. So somehow the woman has been genetically programmed that a certain number of eggs within your body over a period of time are going to just disappear. We call that apoptosis, which is programmed cell death. So pregnancy, you still lose. The pill, you still lose. Because people say, can't I take the pill? Maybe it'll stop me losing the eggs. Makes no difference. And as I say, again, in our country and in most African countries, there's no need to determine paternity. So it's all related to the fact that you're the mother, you gave birth to the baby, you're the biological mother, and the man who is married to you is then the father. So it just becomes a psychological thing more than anything else. So from the law point of view, if that father were to say, well, I'm not carrying on with this relationship, I found a woman half your age, so I'm trading you in, he is still going to be responsible for rearing that child. Yeah, even though he's donor sperm, because his permission was given. In other words, we're at fault if we do not have a signature on a piece of paper that he gave consent for us to get his wife pregnant with donor sperm. He is then automatically the father. Going to fibroids. Fibroids is a scourge of Africa. Now, we probably operate every week, maybe 15 patients a week. Most of the surgical procedures we do are via the laparoscopy that I showed you. So we are removing more and more fibroids laparoscopically and not via an open procedure. Now, we may have a woman who's got 30 fibroids that we are not going to take out laparoscopically, and we will remove those via an open procedure. So it's a big problem. The question is, why do women get fibroids? Fibroids are benign growths in the muscle of the uterus. We think that all women, and for some reason, especially more our African women, have an increased number of stem cells in the muscle of the womb that grow, depending on what the stimulus is, into these fibroids. and they're like big golf balls that develop. They are fibrous tissue structures, and they affect implantation. They cause miscarriages. They cause a lot of pain. They cause heavy bleeding. The patients can become anemic from it. So if the patient is symptomatic, pain, anemia, and whatnot, you have to take them out. If the patient is desiring of a pregnancy, it all depends where the fibroids are in relation to the cavity of the womb. So there are some women that we know you do not need to take those fibroids out, and there are others that we know these fibroids are contributing to why this couple are not falling pregnant. It may not be the only issue, so we remove them. Now, early pregnancies, we think, protects against the fibroid growth, because somehow once these patients have established early pregnancies, I'm saying early 20s, that uterus stretches over 9 months, and we believe that stretching breaks the seedlings. So we tend to see it more commonly in women who delay their childbearing. We see it more in our African population, and it is. For us, it's something we deal with every single day. If we're talking about fibroids, if they're there and we definitely make sure that this is what's causing a problem, we remove them. If they're not, we can treat symptomatically. In other words, if you are having pain, we can stop periods. And we can treat with certain medication if pregnancy is not an issue and you don't want to undergo surgery. So we won't always operate, but yes, it's a daily task of ours. Thank you.